5,000 health assistant. There's a logistic like color coded software scale, airline jammer, KMC binder, KMC booklet, and also hand tab. Next please. And we have developed the innovative technology system, very unique innovation for not only for Bangladesh or Asia. Innovation is a unique for global because its linkage is develop the linkage between facility-based DHS2 tracker and community-based open surface system. You can see the flowchart. When a baby academic scan home, his or her data will be in a scan tracker in a DHS2 platform. And when these people will be discharged, the notification will go to the open access platform of a teacher where the baby is residing. So she will get a notification and a profile will be created in his or tab. And a follow-up event will be created. And when the teacher will follow up that baby, discharge baby at home, this follow-up findings will go to the facility in DHS2 tracker. We have for last 2 years to develop this linkage between facility and community. Now it is in place and we have the system is ready and we are now implementing it. And we have trained 1,500 health workers on this community follow-up and I said it's an appeal. You can see that our 180 newborn dying every day and 40% digital happening at home and 45% at the private facility. For the studies in Iskano, we integrated nature is a big challenge for Bangladesh. And expansion of KMC, evidence says that expansion of KMC can save life. And follow up from system and KMC registered babies can use the control care and use the and for the pilot phase, we are implementing with government in 10 districts. Is community KMC, community farm, is. The system is ready and all the necessary tools, guidelines are ready. But we need your support. That's why in the beginning of the presentation I said it's not a presentation, it's an appeal. It's appeal to all the professionals like radiologists who are working in the different parts of Bangladesh. Please extend your support and help for the advocacy and for the implementation of this very unique and special two interventions. Community PMC and another one is community follow-up of discharged babies, which will help us to reduce the newborn mortality. And you know that for the age treatment, we are in the last mile, which is the toughest mile. And we need extra to go this last mile and achieve the SDG. But I am hopeful that with the support from the professionals like radiologists and clinicians, we will be able to implement this community, KMC and community politics, and we will achieve SDG. Thank you. Thank you very much for your patience here.
For your nice presentation, which is now our demand for the day, as community-based family mother care is our future achievement for the betterment or the fulfillment of the SDG goal. Thank you for your beautiful presentation. Now I am going to request Dr. Jawan Mahmood Emaradul Haq, Health Manager, Lead Maternal Neonatal Child Health Bangladesh UNICEF, Dr. Imran, is present a paper on Bangladesh newborn health landscape. Where to focus now?
Assalamu alaikum. Thank you, madam. The two-million Professor Nazrul Khan, who was leader in implementing scaling up of IMC program in Bangladesh, and then followed by newborn Professor Dr. Mohammad Kirtinasa and the IS chair today. And in front of me, I can see so many of our eminent professors, both pediatricians and neonatologists, and the distinguished participants from home and abroad. Very good morning to everyone. I'll be, first of all, my two colleagues from UNICEF, they try to focus on newborn health, where should we invest, where we should work for newborn health in the country, and how UNICEF is supporting the government of Bangladesh for scaling up different interventions for reducing newborn health in Bangladesh. So with this, I would like to start my presentation. Next slide. So, very recently, United Nations Interagency Group has reported the current situation of under 5 and newborn death. Bangladesh has reduced significantly newborn mortality 58% from 2000 to 2023. Also, under 5 mortality 62% during this time. But still, in 2023, 63,000 newborn died in Bangladesh. Every hour, 7 newborn are dying in our country. So this indicates why we should focus for reducing newborn mortality to achieve our SDG target. Next slide, please. So, I will try to some findings. I use the list life-saving tools. And with these tools, this is basically a projection, a modeling of possible intervention, showing how we can achieve our SDG target. So I show you three different scenarios. One scenario is if no change of coverage from the current coverage, what will be the situation? And second scenario is universal coverage. This universal coverage of different newborn health intervention without 90% coverage of facility delivery. I will explain why I consider facility delivery is very important. And the first scenario, I took 90% of universal coverage both for neonatal health intervention and also maternal health intervention. I believe today in this conference there is no obstetrician and gynecologist. Is anyone here? I think no. But this is very important for us to achieve newborn mortality in the country. I will try to you why this is very important. Next slide, please. Here I am trying to show number of newborn deaths in 2025 to 2030. Without change of coverage, we will not be able to reduce number of deaths, newborn deaths. Very few deaths will reduce. But if we can achieve 90% of the universal coverage, both for neonatal and maternal, then we will be able to reduce 72% of the neonatal deaths with 90% coverage. Next slide, please. But on the coverage of neonatal mortality, these interventions without facility delivery and with facility delivery 90% coverage, the change is, with facility delivery coverage increase, more death can be prevented. So let's see the next slide. If you look at the intervention with newborn coverage without increasing facility delivery, total will be able to additional 48,000 newborn lives will be able to save. And major save will be from case management of neonatal sepsis and pneumonia and case management of premature babies. But routine care, hygiene for care, thermal protection, and immediate drying and wrapping and childbirth environment, it has also impact, but very little impact. But in the next slide, if we increase with newborn health intervention coverage with 90% of the facility delivery, then we will see we get more than 3,500 lives we can save only with increasing facility delivered. Here also you can see the major lives we can be able through case management of neonatal sepsis and pneumonia and case management of premature babies. So these two interventions is saving many newborn lives. And in the next slide, if the universal coverage can be achieved for newborn health intervention as well as for maternal health interventions, then we will be able to achieve around 60,000 newborn lives. Here also, the key intervention is the case management of neonatal sepsis and pneumonia and the case management of premature babies.